Hey, I'm Dr. Anunson. Today we're going to talk about some core exercises that are going to help you strengthen a low back, a weak low back, or a low back that is pretty chronic. Some of our patients do really well adjusting, but they don't want to hold as well, and sometimes it's because of a weak core, and we want to reestablish that core. And there's a time to do it. So as we start to build some of this muscle function back, we're going to start with some really basic ones. We're going to start, and Alyssa here, our assistant's going to show us exactly how to do some of these exercises and what to look for when we're doing them or performing them incorrectly, which can be just as injurious. All right, so go ahead. So Alyssa's going to start out and show us the wrong way to do it first, which is she's cheating. She's going to lift her butt in the air and put more pressure on both ends and not be firing her core like she needs to. So actually, when this is done correctly, she's going to drop the hips down and she's going to try to create a straight line from here to here, from the shoulder down to the feet. She's firing and holding, and if she starts to hold more than 20 seconds, Alyssa can hold this to a minute, but since this is our second or third go-round, she's already been doing some reps. Shoot for about 5 reps at about 20 seconds each. As you do these over time, you'll get stronger and stronger, and our goal is to shoot for a minute in one plank. Good job, Alyssa. Thank you. All right, next exercise, she's going to show us a reverse bridge. So she's going to elevate the hips and show us incorrectly first, Alyssa. What do most folks like to do? She's overarching. If you can see, she's overarching here. It should be less of an arc and more of a straight plank. Here's where she's actually performing it correctly. Again, shoulders to knees is a straight line. And she's going to hold this again for about 20 seconds. She's actually squeezing the buttocks and elevating the hips, but she's doing it in a flat manner. So she wants to be straight in that case. Very good. And again, 20 seconds, 5 reps. Good, Alyssa. Thanks. And the last one, she's going to do a flutter kick. And the caution here, if you look, she is straight-legged, all right? And she's firing her abdominal area, but most people think the core is just the abs. Our core is our abs, our serratus muscles, our paraspinal muscles, our quadratus lumborum, our QL in the back, above the hips. It's part of our glutes, it's our thighs, it's our hamstrings, all the above. And so that core is essential, not just the abdominals. And most people, again, confuse that. They work their abs and they think that's going to fix a low back. And it can enhance low back function, but in some cases it can actually aggravate it. So in this case, Alyssa's doing great as I just killed some time for her. How long do you normally want to hold this one, Alyssa? 20 seconds, she says, as she's starting to breathe a little harder, but she's in good shape. She's literally fluttering, okay? And she's just moving slow, and it works the abs better. The caution, and you can take a break, is if you hear or feel clicking in your hips or your low back with each movement, stop. That is literally cartilage and joints wearing and tearing versus a one-click pop, and then it's gone. That's a different story. So avoid having repetitive noise and clicking while you're doing any of these motions. Thanks. I hope that works out well for you. Like us on Facebook, subscribe to our YouTube channel, and we are out for today. Ciao.